when I get into like a tighter tissue, it'll create a little dimple around the needle itself. Everybody's Dr. Warren here at Kalkstein Chiropractic. I'm with Eddie. Eddie's dealing with some disc pain coming from his lower back. He came in 3 days ago. Just really locked up, kink in his lower back, pain referring into his hip here. I saw Eddie. Eddie, how long ago was that when you first came in?
About a year, 2 years ago.
2 years ago? Came in for a couple sessions. Similar problem, you kind of got fixed up pretty quick. And then I hadn't seen you since then. And when did this kind of start?
It started kind of re-aggravated probably about 2 weeks ago.
2 weeks? What caused it?
Well, some years ago I was lifting television. Something heavy.
That was the original injury.
Yeah, and then it kind of bothered me then, but it kind of went away for a couple of years and just recently came back. So something re-aggravated it, or stop on the exercise.
It's the back stretches that we gave you kind of back in the year or two ago. That helped you out a little bit, just staying mobile in general.
Yes.
You came with right side lower back pain, referring down. You had a positive slump test. You had some compression tests that were positive. Didn't have any neurological weakness or anything along those lines in terms of his extremities. Didn't have weakness in his foot. Didn't have weakness in any of his other muscle groups higher up. But we're looking for some of that foot drop sometimes with this type of a problem. Not the case. Neural tension for sure. In the form of a slump test. Palpatory pain on that right side. Here's, you kind of look, Carly, here's his 12th rib coming right down through here. So if you kind of draw a line like this, and a line like this, that muscle sits right through this window here, and you'll feel this right there as a trigger point on you. So that muscle guarding around the irritation in that nerve. And we're gonna get to that in just a second. So through the examination, saw him 2 days ago. I've seen him twice. This is my third time seeing him daily this week, and then we'll back off next week because he's already feeling a ton better. Not getting any of that pain in the hip. He's moving better. The biggest thing for him is waking up, and he's just feeling so locked up, can't get out of bed. It's a process to get out of bed. That stopped happening this morning, and I decided, hey, come see me a couple times in a row. I'll keep it moving well, and I'll adjust you. I'll do some soft tissue work, and his back is tolerant enough for me to be putting him on dry needling here for this, as well as traction, lumbar decompression. So he's getting his back stretched, he's getting dry needling done. I'm doing hip flex here, soft tissue work, and I'm adjusting his mid and lower back. And once his pain is under control, then we'll get he's already really active. Just today, you can see he's pretty strong. So it's not like I need to build up muscle on him. If anything, just focus on the day-to-day mobility work that you're doing, and just to get on top of some of the stiffness that kind of started to creep up on you. You know what I mean?
Mm-hmm. Yeah.
Is that fair to say?
That's fair to say. Yes, sir.
Can't say I haven't been in the same boat myself, brother.
Yeah, it's a challenge.
Can't be. You got 6, I got 3. I think you win on that battle.
Yeah. It's a battle.
It's a good battle. I'm grateful to be a part of it. That's right. Yeah, I think we feel the same way about that.
It's definitely a good battle.
That's it. So funny. It was hilarious last night. There was a circus around us. I'm sure you know exactly what I'm talking about.
Yeah.
My 2-year-old, she's my middle child.
Oh, wow.
And she's she'll run around or she'll sneak up behind you. She'll like pinch the back of your calf and then run away.
Oh, okay.
I'm like, what are you doing? And she'll smile around the corner.
Peekaboo.
She's picking on her older sister too. It's hilarious.
That's cute.
That's cute, man. You can probably feel those a little bit more. These two on the outside, and I can kind of see the little indent in the needle itself. When I get into like a tighter tissue, it'll create a little dimple around the needle itself. Your low back feels and looked pretty good on the right side, down where we were kind of working in this area.
Yeah.
It shouldn't hurt as much in terms of some of the needles that I did, or feel as sensitive is probably a better way of putting it. Little pressure.
Just a little.
Yeah. And that's right with it. I don't want to be this. Okay, I'm gonna put some stim on this side. You've had your traction already.
Yeah.
And then I'll bring you into a room after this. We'll get you loosened up through some adjustments.
Okay.
And then we'll go from there, alright?
Sounds good, Doc. Sure.
Frequency around 4.3. I do a low frequency. This is a great tool, but drying nose stim, you have multiple channels going at the same time. It's very reliable, Japanese made. So we're gonna go through channels 1 and 2. You're gonna feel them both on the same side. It's gonna kind of feel it together. Strong but comfortable, okay, Eddie?
Okay.
Let me know when you start to feel it. I'll be able to see it on the needles first too, which kind of helps me know when I kind of reach that level that goes beyond that contraction of the tissues. Is that okay? Is that too strong?
Yeah, just a little, just a tad bit.
I'll back it off. All good. How's that?
Just a little more. Yeah, that's perfect, Doc.
Good right there?
Yeah.
Alright.
That's perfect.
And you're going to feel one a little bit closer to the spine. Let me know when that one's good for you.
Okay. Yeah, that's perfect.
Okay, I'm going to back it up a little because it's going to get stronger while you lay here.
Okay.
I can change it again. Is that better? Is that good for you right now where it stands?
Yep, that's good.
Alright, you'll be here for a couple minutes, okay? Come back and pull this all for you and then we'll get you into a room, alright?
Okay.